call the meeting to order and get started. Mr. Nielsen's not here yet, but I assume he will be here shortly. The Assembly is sitting in floor session today, and we've been asked to return to the floor by 3 o'clock. And because of the importance of this committee hearing, I don't want to rush it in order to meet a deadline, so we will get started. Members, we've convened this hearing to continue the legislature's review of how the large-scale changes that were adopted for in-home supportive services within the July budget packet are being implemented. As you know, this is our third oversight hearing on this issue, and we continue to do oversight as we go along because there's been some difficulties that have presented themselves as we've gone on. Much of this is caused by difficulties in communication that have fueled many deep and pressing and unresolved questions within the IHSS community, and counties found themselves caught in a trap of enforcing conflicting, late, and incomplete instructions for new provider enrollment effective November 1. Our task, I believe, collectively, not just the legislature, but the administration and the counties as well, is to turn this negative situation into a positive one. It's very worrisome to the committee, and this is one of the reasons for this hearing today, is that more changes to the IHSS program are being phased in April 1 and June 30th. And so part of the reason we're here today is to discuss what the status of those changes are and how we're moving forward on those so we don't repeat the most recent experience. Just to review quickly the context of what happened in November. For new consumers who are coming into the program November 1, it was unclear how their chosen provider, if that provider was a new provider, how they would be enrolled in the program and able to provide the services that IHSS gives to consumers who are disabled, elderly, and frail to keep them in their homes and out of costly institutionalization. Just to refresh people's memory, last fall, 29 counties from all around the state sent us letters about their concerns. In part, this was due to frustration with the Department of Social Services in sending out guidance to counties at 10:21 p.m. on Saturday, October 31st, for changes that were to be effective on the next day. It was a low moment, I would say, because this has traditionally not been the way that things like this have been handled. And unfortunately, we faced some empty chairs at our last hearing. I don't believe we've got that problem this year. At this hearing, and I appreciate everybody's attendance. And I think that time has passed. I think some of the frustration has eased, and it appears that some progress is being made, and that is the second focus of this hearing, is to find out what progress has been made as far as the implementation of the rules from November 1st. In addition, as I said, I'm also interested in hearing the precise plans the administration intends to use for additional program changes that have yet to be taking effect, the soonest of which is April 1, the date for fingerprinting of new clients, and followed, as I said before, by additional changes at the end of June. So there's some specific questions that I would like the Department of Social Services to address. First is, are we ready for April? And if not, what needs to be done, what remains to be done? And then the same question for July. What is the department's plan to work towards these implementation dates? How will the department work with stakeholders, given the statutory requirement to do that? And what will that process look like? And at what point will the department release draft and final instructions to the counties for both of those deadlines? Of course, it's important to allow lead time, proper attention to training elements that must also occur before those deadlines. And most importantly, I'd like to know how we can ensure that consumers are not barred from receiving services if the counties are not equipped and trained to comply by the deadlines. So I believe these are reasonable and important questions to raise given the gravity of 460,000 people served by the program and 385,000 providers who do this very intimate and very difficult and challenging work to keep consumers healthy and in their homes. Just a brief comment about the process. We do have two panels to speak. And I just wanted to mention we're not taking public hearing at this hearing. We're not taking public testimony and public comment, but we do have cards that are outside in the hallway, and we encourage the public to fill them out instead in lieu of personal testimony, because we do want your comments and your input. So if you fill out one of those cards, be sure you deliver it to the sergeant's desk up here in front, and we will review those later. So finally, this hearing will provide us with the chance to examine our ability to implement these new policies in a timely manner. And I do want to recognize as well that furloughs have taken a toll on all of the departments in the state, especially the Department of Social Services. And it's with dismay that I look at the governor's Proposition 58 major policy proposals, which he expects the department to implement before July 1. And so I'm keeping in context the fact that employees there have been furloughed, and that's got to have an impact on our ability to get this work done. And I mean our, not just our ability collectively to get this work done. With that, I'd ask Mr. Leno, the chair of the Senate Budget Subcommittee 3, if he has any opening comments.
Thank you, Madam Chair, for the invitation to join you today as chair of the Budget Subcommittee on Health and Human Services. It's always a pleasure to be among Assembly colleagues. And also to thank you for your tenacious attention and oversight of what is a very challenging transitional period. Since January 8th, there were about 5,600 providers who have completed the new enrollment process and about 12,000 provider applicants in pending status. So that's a total of 17,600. Facing the June 30th deadline, we have 385,000 providers who were enrolled prior to November 1st of last year, but are required to undergo most of the same requirements of the new providers. So extrapolating out over 5 months until the end of June, that's approximately 100 working days, not including furloughs, divided into 385,000 providers. That's 3,850 providers per day. 480 per hour. We're talking about fingerprints going to DOJ and coming back, and all of this being processed. So it's an enormous challenge that we face, and as the chairwoman has already described, we're talking about over 400,000 clients, recipients of these services, in addition to all of these providers whose futures are uncertain. So it'll be of great importance for us all to hear from the department and other stakeholders today. Hopefully, at the end of the hearing, we may be able to determine that there could be some relaxation, potentially, if we find it necessary, so that we're operating in the real world and not expecting things to happen that logistically just can't happen. But that is yet to be determined. And then I also, Madam Chair and colleagues, ask you to excuse me as I have to leave. Unfortunately, I was planning to be here for the entire hour and a half, but that's not the case. But I'm, again, very pleased to be with you today.
Thank you. Mr. Nielsen.
Thank you, Madam Chair, and I as well thank you for your fastidious attention to these follow-ups, if you will, of the budget resolution, and a kind of a message to the agencies, plural, that are affected by the budget resolution, not just IHSS agencies, plural, health services, but all others, that the legislature is going to be watching and monitoring the progress that you are making toward implementing whatever the reforms or reductions or changes that we have requested or that we have authorized in the legislation. And this kind of scrutiny will indeed continue, and if there's foot dragging simply to avoid the impact, then there will be consequences for that. We do expect that these savings that we had hoped to achieve will in fact be achieved.
Thank you, Mr. Nielsen. I believe Mr. Chesborough has a very, very brief comment because we're going to hold comments and questions to the end of each panel. But Mr. Chesborough.
I know you want to get started, and we don't have much time, so I'll be very brief. We were pretty hard on the departments when they were here before. You were, I know I was, and others. A lot of progress has been made. I want to acknowledge that and say that that's appreciated. But the bottom line is IHSS consumers deserve and are legally entitled to live in the community with supports. And so we have to stay on this and continue to scrutinize it heavily.
I agree. Thank you very much, and thanks for keeping it brief. All right, our first panel is John Wagner, who's the director of the California Department of Social Services, and along with Mr. Wagner is the program deputy director for benefits and services, and Pete Cervenka, and Eva Lopez, the Deputy Director for the Adult Programs Division. So my understanding is, Mr. Wagner, you're going to make the presentation on behalf of the department, and they will fill in any blanks. Then we have Robert O'Neill, Deputy Director, Audits and Investigations Division of the Department of Healthcare Services. And then Kathy Sunderling McDonald, Senior Legislative Advocate for County Welfare Directors Association. So we'll start with Mr. Wagner, and welcome, and I appreciate your being here today.
Chairwoman Evans, Chairman Leno, and members of the committee and subcommittee, thank you for this opportunity. My name is John Wagner, and I'm the Director of the California Department of Social Services. And I want to echo what you said, Madam Chair, about using an opportunity to move forward in a positive direction and learn from these past few months. I'm joined by my staff, including Pete Cervenka and Deputy Director Eva Lopez, who oversees the Adult Programs Division within DSS, which oversees the IHSS, or In-Home Support Services program. We've met with your staff who have identified issues they've indicated you'd like to discuss, and as you highlighted in your opening remarks. So I'll provide some opening remarks and touch on some of those issues, and then turn it over to Deputy Director Lopez to provide some additional details. At the first IHSS oversight hearing, the department acknowledged the difficult implementation issues given the significant reforms to the IHSS program. These challenges were brought on by several factors, including extremely aggressive timeframes, litigation that has delayed and in some cases changed or reversed direction provided earlier to counties, and significant changes in the program, as members have mentioned, as spelled out in last year's budget agreement. In addition, in an attempt to get out as much information as possible, given these significant changes to recipients, what was well-intentioned communication via a mass mailer unfortunately resulted in additional confusion in an already complex program. We committed then, and we continue to commit, to work with stakeholders, including legislative partners, in identifying significant issues for further clarification and resolution. Towards this end, since our last hearing, the department has done a number of things that I'd just like to highlight. We've conducted conference calls between DSS staff and counties, including the Department of Justice, when needed, to ensure issues are being raised and worked on. We have met with CWDA and county partners on 10 occasions for the same purpose and sought their input on ongoing issues and needs. Furthermore, I have reached out to each county welfare director, in addition to each deputy director at the county level overseeing the IHSS program and the public authorities, to share with them the status of the state's efforts to resolve issues already identified and seeking their input should additional areas need work and focus. In addition, we are committed to broader stakeholder input and have circulated additional 11 directives through various IHSS stakeholders, not yet to the counties, but through the stakeholders, expanding upon what was earlier stipulated to be a truncated stakeholder input process given the initial time frame for these reforms. The commitment to expanding stakeholder input continues as we're beginning to implement monthly discussions with stakeholders, as well as scheduling our first major stakeholder meeting to discuss the anti-fraud protocols. Finally, our Adult Programs Division staff are just wrapping up another telephone survey reaching out to staff from all 58 counties and the 56 public authorities to assess the implementation status of several key initiatives and to identify additional ongoing issues. Though still analyzing these results, Deputy Director Lopez will be speaking about them in greater detail. As you know, and as you mentioned, Madam Chair, one of the key initial reforms that began to be implemented November 1st was the new provider enrollment process. This process required a background check for all prospective providers. We have worked diligently with counties and the Department of Justice to ensure that all counties have an established and workable process with the Department of Justice to implement these background checks. As individual county issues were raised, and they were, DSS and DOJ staff worked to resolve them. Today, all 58 counties now have an agreement with the Department of Justice. Successful implementation of IHSS reforms is a priority for the department. and I'd like to underscore my commitment to bringing together all of the department's internal resources needed for this significant effort. We continue to use an interdivisional work group internal to DSS to work on many of the cross-cutting issues being brought up during stakeholder and county discussions. In addition, I've contacted my colleague, the Director of the Department of Healthcare Services, David Maxwell Jolly, to establish an interdepartmental work group. As many of you know, IHSS may have had its beginning as a social services program, but now is predominantly Medicaid or Medi-Cal, adding to its complexity. Senior staff from both departments have met earlier this month, and we're committed to having ongoing meetings to facilitate resolution of interdepartmental issues and ensure better communication on some of the components of the reforms that involve both departments. These and other collaborative efforts will better prepare us for the significant work that lies ahead, including impending deadlines for recipient fingerprinting, current provider enrollment procedures, and implementation of some of the additional anti-fraud program integrity efforts, including home visits and targeted mailings. To be clear, we have not implemented those anti-fraud measures, including home visits, as contained in the budget agreement. And I know the Department of Health Care Services is here to speak and address these anti-fraud efforts and investigations. This is significant work, and DSS continues to do the best job we can under extremely challenging circumstances, including a significant reduction in our own resources as California continues to face a severe budget deficit that has consequences for all of us, my department included. I'd like to acknowledge the hard work and dedication of staff within our Adult Programs Division, including Deputy Director Lopez, who continues to give 110% of their time and talents to implementing some very difficult and complex reforms, and who remain extremely committed to the IHSS program. My final point is that we will use these efforts described above to inform trailer bill language that will be released the first week of February. We know there have been questions about the DOJ process and clarifications on authority to share information that we do intend to address in trailer bill language. In addition, as I offered at the first hearing, the administration is working with you on new language regarding the list of crimes that would bar individuals from being an IHSS provider. In addition, the department is continuing to analyze the information we're receiving from our direct surveys that I just mentioned to counties and public authorities, especially around the impending timeframes for April 1st for the implementation of recipient fingerprinting and the July 1st deadline for ensuring current providers that they have undergone the new provider enrollment procedures. The administration is committed to working with our county partners to ensure that come July 1, no providers are unnecessarily terminated from the program due to these procedures. And as usual, should the committee feel that the trailer bill language doesn't address all concerns, we're happy to work with you during the special session and the budget debate that will ensue. I'd like to now turn it over to Deputy Director Eva Lopez, who can provide some of the additional information on the items you've placed on the agenda, including the current survey of counties and public authorities.
Before you start to speak, Ms. Lopez, Mr. Wagner, just a point of clarification. Did you say you were submitting trailer bill language the first week in February?
Well, that it would be released the first week. I know some of it has been worked on with staff.
I'm not familiar with it, but the first week of February is the date that you're shooting for the language.
Yes, for the trailer bill language, yes.
Yeah. Ms. Lopez.
Good afternoon. Eva Lopez from the Department of Social Services, Deputy Director of our Adult Programs Division. I'm going to proceed with providing you an update of what the department has done since the last hearing, and I think it will address some of the key questions that were included in the agenda. First off, as indicated by Director Wagner, we have done a tremendous amount of work during the last few months, and one of the things that we're sharing for you, not that I'm going to necessarily walk through it, is for your information. We have also provided copies for folks in the audience. You will see 4 handouts in that folder. There are 2 handouts that are timelines we call pipelines. One of them is for the provider enrollment process. The second one is for the anti-fraud, fraud detection and prevention process, which will give you key dates of things that have occurred or will occur as we go through the next few months. In addition, there is a third handout, which is a graph. The graph is providing you information on the provider enrollment counts. Our CMIP system tracks how the enrollment process is going, and Senator Leno mentioned a date or a number of providers that have either been enrolled or in the pending status. You will see from the graph that those numbers are moving, are changing. So, and the other thing in regards to the numbers, you will also see when you go into our website for the department, we will be posting that information on a weekly basis. The last handout is a handout that provides you a listing of the stakeholders that we've been providing all county letters, all county information notices, etc. Included in that document, you will see at the end that we have provided an email address if there's any other stakeholders that would like to be part of our distribution effort for future stakeholder processes. So if you can please utilize that email address, it would be greatly appreciated. Okay? So with that, just over some of the items that we have been doing over the last few months. The fiscal year 2009-10 funding was augmented and has been allocated to support the new program and administrative requirements. A county fiscal letter went out on that. The County Board of Supervisors applied for and were awarded anti-fraud funding, and there was a county fiscal letter releasing that pot of money. Written materials related to the provider enrollment and provider orientation have been translated into the 3 threshold languages for IHSS, Spanish, Chinese, and Armenian, and are available to the counties, including the translation of the CD-ROM, which was released to the counties on January 14, 2010. In addition, we have released all county letters and made all the appropriate system modifications to address the recent temporary restraining order in regards to the crimes. We released a series of draft question and answers, all county letters for review and comment on the overall IHSS reforms. Since then, we have broken the all county letter into 2 all county letters. The first one, which is the one that addresses Department of Justice and criminal background checks and fingerprinting issues, is the one that will be in our 3rd version of review and comment, and we're looking to release that by next week in final form. The second all-county letter, which will address all of the other IHSS reform items, that is, we hope to release by the end of this week, beginning of next week, a second version, a draft for review and comment as well. And we hope by the middle of February that all-county letter will be finalized. As I mentioned to you, we have been working with our stakeholders, counties, public authorities, and reviewing all of their comments that they've been providing us. In order to release the best guidance and best information to them on the issues that they've brought forward. We also still continue to use our contact point, a phone number that had been provided to all counties, to relay any implementation questions, issues that they may be encountering. As Director Wagner mentioned, we have in fact engaged counties and public authorities in our discussions with Department of Justice to resolve some of the issues that have come about because of the differences in our processes. We have increased the frequency of our Social Security number verification data runs, which was a key issue to some of our county partners, from once a week to twice a week in order to provide them additional information on a more timely basis. We have committed both our departmental staff and CMIPS, which is our vendor, resources to screen for individuals that are on the Department of Healthcare Services suspended and ineligible list, and thereby providing significant workload relief to the counties and public authorities. And we've been working and will continue to work to finalize that direction to the counties. And we've also instituted weekly tracking of the provider enrollment numbers, which is ties to the graph that you have. Now, one of the things that Director Wagner mentioned is that we did, in fact, and in our effort to reach out and find out how the counties are doing in the local sector, both in the counties, public authorities, and even some of our county quality assurance staff, to identify any systemic issues that they were encountering. On December 30th and January 7th, we proceeded and made contacts to counties to discuss their provider enrollment process, specifically where they were there any issues, what were the issues, did they have their ORI number, et cetera. And specifically the issues that they mentioned, there were a variety of issues they mentioned were being caused in some of these counties, were identified anywhere from ranging that they were just receiving their ORI number, their originating response indicator from DOJ. They were just received final approval from their board of supervisors because there at times have to be agreements between the public authority and the welfare departments. As well as delays in the data entry into the system because of resource issues within the county. So those are some of the examples of the issues that they were encountering. In addition, we made some subsequent calls. We made calls to all public authorities and also send emails to all 58 counties trying to, again, determine what other issues they might be encountering, specific in the areas of operational issues they were encountering, any adverse events in their county in terms of the recipient, whether they had sufficient number of providers enrolled, and so forth. These calls occurred and emails between January 21st and then again on January 22nd. As of the 26th of January, we did receive responses from 21 counties and 32 public authorities. The majority of respondents reported a couple of items. One, although there were no issues with recipients obtaining a provider, because in some of their counties they have a provider registry that has providers included in the registry. They did raise concerns that providers and recipients were concerned about the process being longer than it used to, their ability to get paid sooner, the concept of working for free. Some of those issues were brought forward. Also, they expressed some concerns with the June 30th date in terms of trying to get all their population. Other counties said they were on track, really depending on size of the county and or how the processes that they've established with their public authority, et cetera. In terms of the quality assurance staff, we contacted them to see if there were any critical incident reports, maybe having to do with any of these enrollment processes. And they did report back that no, they had not received any report, keeping in mind that the quality assurance staff focuses more on critical incident reports due to when they review cases, et cetera. So again, we were just trying to reach out to anyone we could to just determine what the issues were the counties might be encountering. Some other issues is that general delays in the enrollment process because of the Social Security number verification, and as I mentioned earlier, we're working to try to expedite that. DOJ, Department of Justice backlog and how soon they get the information back. There was some in delaying because of delay in processing of the timesheets, and then increased workload because the counties are also dealing with a lot of the fiscal issues that we all are dealing with. One other thing that we did is we did send a separate email out specifically to some of the larger counties, Los Angeles, Riverside, Alameda, Marin, San Diego, Orange, and Sacramento, to determine what their plan was to try to end all the providers by the end of June. And they gave us some examples of the things they're working towards. And some of them is obviously within their own staffing, borrowing from other existing staff, et cetera, developing an expedited enrollment process once fingerprint and it's been cleared through the Department of Justice, encouraging existing providers to enroll. Some counties are even doing things in the weekend to provide orientation process for their providers, or developing outreach procedures for themselves to send out. And also creating a provider enrollment center to streamline the process. So in our efforts, even with this information, as Director Wagner mentioned, we're still reviewing and we're going to continue to be in contact with the counties and helping them and assisting them any way we can as we're trying to reach that June 30th date. One of the things that's in your graph, I think you will notice, as of January 26, our CMIP system shows that there are 9,556 providers that have been enrolled in our process, and 20,172 providers are pending enrollment. Being in the pending status means that the providers have begun the enrollment process and still must complete one or more of the enrollment requirements, such as the fingerprint process through DOJ. complete the provider orientation, complete and sign the provider enrollment form, and complete and sign the provider agreement form. As we mentioned, we will continue to monitor and discuss with the counties and public authorities the progress that is being made towards enrolling all the current and prospective providers. Additionally, we will be looking to discuss approaches that could encourage providers to move forward in completing the new enrollment process by the June 30th date. Key issues. As we mentioned, we have released an all-county letter with question and answers, and I want to focus on some of the key issues that we're working through and that we've worked through, again, with the public authorities, counties, and Department of Justice as it relates to the fingerprinting process. Some of the key issues are the CORI, the ORI, the originating number, and provider appeals. Specifically, counties and public authorities have expressed concerns that their authority to provide a copy of the CORI to an individual who has been found ineligible to be a provider due to a criminal conviction and to provide DSS, the Department's Provider Eligibility Appeals Unit, with the conviction information necessary to assess the county determination. The feeling is that they had received Department of Justice direction some years back that basically said you could not do that. And although we have been working with Department of Justice, and Department of Justice has verbally informed the county representatives and the public authorities that they would be able to provide the information, the counties are feeling like they need something from the Department of Justice. So we have been working and will continue to work with Department of Justice for them to release something other than just our all-county letter. The other issue that has been raised is subsequent arrest reports. Again, process that we're working through with Department of Justice, trying to address those issues. The other key issue is the suspended and ineligible list that I'm sure you've heard of. As you know, 98% of our program is funded with Medi-Cal dollars, and 98% of our recipients receive federal dollars in terms of the services that they provide. And because of that, and in order to be eligible for the federal financial participation, we have to abide by the Medi-Cal rules, which is that we will look at individuals who are in this suspended and ineligible list before we allow a provider to be an eligible provider. There is statute, both in federal law and in state statute, that mandates this, and we will be more than happy to share that with you. However, based on the direction from the Department of Health Care Services, that is our statutory requirement, so as such, we're following through. However, on the suspended and ineligible, because we want to be able to address the issues that the counties have expressed, and that is because on the suspended and ineligible list, it's almost 18 reports that the counties would have to be comparing. We, the department, have now worked out a process, and we'll be informing the counties of this and have shared with them our intent on how we are going to facilitate that process, where we in the state will review the information and then provide it to the counties. One other issue that has been questioned is the retroactive pay. Retroactive pay, as we have stated in the past, is not something new to our program. It's something that has been available even prior to the enrollment process. And we continue to work with the counties, public authorities, and the counties in terms of informing the client when they come in through the eligibility process and or the provider when they're going through the enrollment process, that they need to complete the full enrollment process, and once they do that, we will, in fact, pay them retroactively. We are open to include information regarding the retroactive pay as other revisions to notices are required. In addition, if further guidance is needed from the county's perspective and or the public authorities, we would be happy to send further guidance so that it's clear. Stakeholder collaboration, stakeholder process in terms of ensuring that people know the things that we're sending out. Right now, there are two key stakeholder meetings that we will be in the process of scheduling. The first one is February 11th, and if you were to look at one of the pipelines, you will see that. And that we will be sending out, that's a tentative date right now, that's what we're targeting, in order to have discussions with stakeholders in regards to the fingerprinting of recipients. The second stakeholder process that we will be working on for March is, I think, March 4th. and we will also be sending invitations to that to all of our stakeholders. And that specific March 4th is to discuss how we're going to deal with some of the other program integrity reforms. And that is such as the social worker training, the targeted mailing, the unannounced visits, etc. So those are 2 key dates that we will be putting on the schedule, be sending invitations to not only the people that you see on the list that we provided in your folder, but any other additional stakeholders who call us or send us an email that are interested in participating.
I'm going to need you to, this is all very important, but I do
Okay.
need you to wrap up in a couple of minutes because we still have 3 more people we need to.
That's fine. As a matter of fact, you basically those are some of the issues that we've been
Yeah.
working on, and that provides you the overview of where we're at with that. So I'm
Thank
open
you.
to answer any other questions.
No, and I appreciate a lot of the detail because I know this is very detail-oriented, and while to us some of it's kind of gobbledygook when we get into a lot of the ACLs and this and that, that it sounds that way, but it's people's lives that are at stake, and I appreciate it. And I think you've addressed a lot of the questions that we had asked you to talk about. Mr. Cervenka, did you have any more to add?
No, in the interest of time, I'll go ahead and pass for now. But
Thanks.
Here to answer your question.
Yeah, thank you. I appreciate that. Then we will go on to Mr. O'Neill. Again, he's the Deputy Director of Audits and Investigation in the Department of Healthcare Services. Mr. O'Neill.
Madam Chair, members of the committee, as Director Wagner has already testified, the Department of Healthcare Services has not begun any in-home visits based upon the current legislation. Since 2004, however, we have had an ongoing program exercising our responsibilities under the federal law for fraud, waste, and abuse and program integrity under the Medicaid program. We continue to stand by to support Department of Social Services in their endeavors to develop the protocols, and we continue to work with counties at their request to assist them in any way that we can.
Thank you very much. Ms. Senderling McDonald.
Thank you, Madam Chair and members. I appreciate the opportunity to speak today, and thank you for convening this second follow-up, 3rd hearing in total to the original hearing. I think it is a good time to check in to see how things are going and especially discuss what's coming up on the horizon. And as for how things are going with the November 1st changes, definitely better, much better than the last time we reported. And I would say that Deputy Director Lopez gave a pretty accurate description of how things have been going. And it seems like things are being worked out. It just takes a little time to get the logistics on some of this stuff put away. The numbers are still low, as you can see from your chart, but they are increasing up to about 30,000 total providers now in the pipeline. And that's a mix of some providers who are brand new to the program, who've come in since November 1st, never in IHSS, as well as some current providers who've started the process early of going through these requirements. That's the current providers, of course, have until June 30th to get that done. And I think what we're hearing from the counties and what we've experienced at the CWDA office is that we've certainly been working much better in partnership with CDSS than you'd heard in November. We've had meaningful opportunities to be engaged on the Q&As that are being developed, and really it does feel much more, again, like the partnership that we've grown to expect in our workings with the department, so that's good news. And certainly we appreciate, and our directors appreciate, Director Wagner's direct personal involvement with these issues. There are a few key issues left to be resolved. In the interest of time, I'll sort of say ditto to Deputy Director Lopez's issues that she listed. I think the retroactive pay and just making sure that it's clear what can be expected and under what circumstances will be something that we'd like to follow up with her to make sure that the counties understand that and that we can make sure when we talk with providers who are new to the program and consumers who are either new or who are changing providers so they understand exactly what the rules are and what they can expect, since there is this period of time where they are essentially working for free with the promise of the retroactive pay. Though it's not a new concept to the program overall, there's a lot more people in that situation than we've seen before, and so making sure that it's very clear what the rules are will be important. Looking ahead, obviously there is a lot on the horizon. Senator Leno's math shows the June 30th deadline looming pretty large for getting those 390,000 current providers through the system. Counties have been working through the backlog of new providers that started coming into the system in November, so we're still a little behind the 8 ball with getting all of them in, plus having to get through this 390,000 current providers. Why we're here, how that happened, it's well-tread ground. You heard about it in the other hearing, so I'm not going to get into the details. But just what we're hopeful is that we can work with the department, so as in contrast to November when the computer system really drove a lot of the policy, we can take a step back, figure out what the best thing is to do for consumers and providers, and hopefully we can sort of drive the computer system that way rather than it driving us, which I think was a lot of the concerns that you'd heard back in November. As far as the April 1st changes, I'd like to just touch on those. This is the recipient finger imaging requirement that's in the law. I think there's a couple things to consider here as you think about the best way to go about this. The law says finger imaging, and we are in discussions now with the department about what does that mean. Is it are we taking fingerprints, or are we actually going out with imaging equipment to take electronic images and then compare? The whole point here is duplicate aid. We want to make sure that folks are not only who they say they are, but that they're receiving services in one place. And we could certainly get into discussions about whether there's a lot of duplicate aid fraud, but it is the law. So looking forward, how do we do this? How do we check duplicate aid? We just say to you that as we talk through this with the department and with you all as part of the budget discussions, think about whether an interim solution is actually getting at the question of duplicate aid fraud. If we're doing something just to do something, it doesn't seem to make a lot of sense when our social workers are really overwhelmed right now just trying to get these providers through the system. A really important statistic that I can share with you is that we're currently funded to get 8 hours of worker time, county worker time per year per enrollee. And that includes bringing them into the program, reassessing their needs both once a year and as they call us if their needs change, and entering in all timesheet information that the providers give to us and working things out with the providers as well. 8 hours a year. And there was no additional money provided in the budget for this finger imaging activity. And so just consider that as we talk further, which I know we will both in this hearing and as the budget goes on. As we sort of think about it, we tend to think on sort of doing it once and doing it well. And then lastly, with the home visits and the targeted mailings that you've heard about, for us it's really all about getting these protocols developed. We really appreciate that the stakeholder group's going to start now. That seems to be the best way to do it. Let's get talking, because we don't want county folks, state folks, other state folks out just tripping over each other. And sort of figuring out how to define things like what is unannounced. Is that no notice whatsoever? I've spoken personally to an IHSS recipient who is as she put it, quite with it. She's in her 80s, and she has an extreme chemical sensitivity. She typically has to educate people before they come into her house about wearing cologne or even using bath products that smell, because she could actually get physically sick. And she called me and was petrified about the idea of someone just showing up on her doorstep and not knowing any of this and possibly making her sick. She, of course, is the minority, not the majority of our consumers, but thinking about how to thoughtfully and appropriately go to people's homes, show up on their doorstep, and how can we really work this out. It's all about developing these protocols in a way that makes sense for program integrity. And the last thing I want to say about that is for us that it's not just about anti-fraud, but it's also about quality. This is an opportunity as we go out to consumers' homes. Are the services being provided, and are they being provided in a way that we would hope? Making sure that it's not just they're being provided, yes, and checking a box, but thinking more thoughtfully. Let's use this as an opportunity about quality, not just about fraud. In closing, obviously much progress has been made, and we really appreciate the comments from Director Wagner and his staff. What we commit to do is participate in the stakeholder group, of course, and keep you and your staff in the loop as these things progress toward the April 1st date, toward that June 30th date, so we can continue to communicate. So hopefully we're not here on March 31st freaking out at you. So it would be glad to answer any questions.
Thank you. I think we all want to avoid that kind of a situation. Ms. Sunderling McDonald, I'll start with you on my questions for point of clarification. You talked about the interim solution regarding, I believe, fingerprinting. Could you put that a little bit more in context for the committee members? Why are we talking about interim solution as opposed to the fingerprinting that's supposed to start on July 1, is my understanding?
Certainly.
what are you talking
What
about?
are we
as
talking?
far as-
What do I mean? And I'll start that, and perhaps the social services folks can help me. In the governor's budget, there's a proposal to purchase digital cameras and do, I guess, fingerprint pads, so that our workers, when they enroll someone into the program or do an annual renewal for folks, can take the finger image and also take a photo. And this is being proposed as clearly an interim step because in our conversations with the department, what they would like to try to do is get mobile finger imaging devices where a finger image is actually digitally scanned, and you could then upload it into some kind of database. We've talked with them about using similar concepts to the current finger imaging system that's in use for CalWorks and food stamps, though I'm assuming it would be those ideas, not necessarily that exact system, because you'd mix up the people.
Interim meaning post July 1.
Well, post April 1 is my understanding.
Post-April
So
1,
April 1 is the deadline for that. And
Okay.
so I think, and perhaps Ms. Lopez or Mr. Wagner could help with this, my understanding is that it doesn't look like these mobile imaging devices will be ready by April 1st. And so in the interest of trying to do something, the proposal in the budget is the cameras and the fingerprint pads. So we've got some questions about that.
I understand the fingerprint pads, but I don't understand the camera. Where's that required by law?
So maybe I could.
And what's the purpose of that?
Yeah, pick up and as Kathy had indicated, part of the reason for the recipient fingerprinting and work that we're doing in that part of the budget agreement is to prevent duplicate aid. Prevention of duplicate aid, not just for IHSS, but for our other programs as well, establishes two things. It requires two things: that we have to establish the identity of the person so we know who they are, and we also have to take a fingerprint, something that can be matched across the system. These consumers don't always have the same social worker. They're not always dealing with the same individual. So these two components, we are looking at options, and our proposal is to take the options that we have from some of our other programs and present them to the stakeholder group, which Deputy Director Lopez mentioned is convening in mid-February, and present them as options that can be potentially implemented given the resources in the budget agreement. If there are other workable ideas or solutions, we're happy to explore them. But our read of the statute is that we need to begin some sort of process by April 1st. And so part of the discussions at the stakeholder group will be, what does that look like? How quickly can these technological options be rolled out? And we certainly will take into consideration the comments that Ms. Senderling is raising, which is the workload issues on social workers and the impact on training should different solutions be needed.
Okay, fair enough. I think.
Wait,
though,
Madam Chair?
Wait.
But as a follow-up to your question, though.
Wait,
because
Mr. Adams, I'm not done with following up on my question. So,
I understand that, but it appears that you're ready to move on, and I'm not sure.
No, I'm not ready to move
the
on.
answer to
no,
the
I'm
question.
not. Excuse me, I'm not ready to move on. I have a follow-up question, and when
Okay.
I'm done with my follow-up question to that, if you have follow-up questions on the same item, I'll let you do that. But let me finish with my questioning on this issue. What is concerning me, I mean, an interim step to implement this is fine as long as it's, being done in a way that can be implemented rather, in a practical way. What I'm concerned about, though, and I'm not sure that I want to go into detail about this right now. It may be better in the budget process itself because we're really exercising oversight functions right now. But I question whether or not the cameras are necessary and why the state would want to purchase cameras when photographing of the recipients is not in any way, my understanding, required by law.
And again, I think the effort is to try to make sure that as we implement efforts to prevent duplicate aid, we can establish identity. If there's other ways to do that and to match it, that's part of the stakeholder process we're willing to look at. I'll also say that, just the construction of the budget required certain assumptions to be made back in November based on the best information. And so we were required to make those estimates. And so some of the language is based on those assumptions and estimates based back in November.
But aren't you identifying people already when you provide services? I mean, when they go through the application process? I don't understand why duplication of a photograph is in your mind necessary?
For example, if a finger image was scanned, you could match finger images within a centralized database and see if people are receiving duplicate aid.
Well,
but that does not establish identity. Because a social worker could go to a consumer's house one day, 6 months later go to the consumer's house and be a different social worker. How do you know that that individual is that person? And so some of the other programs, our welfare programs, use a different system that contains both a digital image and a finger image.
Okay. Well, I understand, and I don't want to argue with you at this point, but I do want you to hear my concern being expressed right now, that I don't believe that's required by law, and I question the value of an investment in however many cameras, digital cameras, the counties would have to purchase in order to do this. So we'll explore this a little bit more in the budget process. But now, I have Mr. Ruskin as the first person that has a question, but if you wanted to follow up on that specific item, I'll give you the courtesy of doing that.
That's very kind.
Mr.
Thank you, Madam Chair. I certainly appreciate it. My apologies for interrupting you. But I'm trying to understand the concern that Madam Chair raises over the issue of increased levels of identity. And this is one of the things I'm struggling to understand. It seems like Mr. Wagner is offering a fairly straightforward explanation for why it's necessary to have a fingerprint and a photograph, and notwithstanding the fact that he may not have a statutory obligation, I still don't fundamentally understand what the objection is to being able to identify somebody by sight versus having to have the equipment to determine whether a fingerprint matches from point A to point B. And so I'm trying to understand if maybe I'm misunderstanding the question, or if it's just a function of a concern over a financial constraint that the state may face.
Well, I'm just raising a concern at this point, and I'm not prepared to debate it, nor am I prepared for us to try to take evidence on that issue. I think it's more properly addressed in the budget hearings that we're going to start having, because this is part of the governor's budget proposal. But I am expressing that concern right now because it was raised by the panel. But I don't think it necessarily requires our hearing time to be taken up on that issue. There's a question of privacy. People that receive IHSS are still entitled to a level of privacy. And so we're going to have that debate a little bit later. But I did want to at least ask the questions about why we're doing this on an interim basis. Mr. Ruskin and then Mr. Swanson, did others have questions? I would like to put you on the list. Just raise your hand.
I have a few clarifying questions. The graph that you gave us is quite interesting. Am I correct that those totals are cumulative?
I'm sorry.
They're cumulative over time. They're not month by month separate totals, right? They're cumulative over time.
Yes.
Okay. And then two other questions. When somebody becomes a provider, when someone is accepted as a provider, does that necessarily mean that there is a specific recipient in mind, or can some people qualify as providers without a specific recipient already in charge?
No, our program is tied to the recipient. Okay. It's the recipient who is key.
All right.
If services are provided, they're entitled to a provider, and that's how the provider comes into.
And then I'm noticing the continual significant increase in people applying for eligibility. Perhaps it's not as significant an increase as it seems because we're looking at a snapshot in time. But if it's true, why are the number of? Do you have a sense of why the number of people applying for eligibility is increasing so rapidly? Is that in relation simply to the new law, and there have already been providers, or is there a rapid increase in the need for providers at this time?
Well, I think the key here, and the reason you see the increase, as you say, the significant increase, you could define significant, it's due to the fact that counties now have either their ORI numbers from Department of Justice, they're structurally ready to address the provider enrollment process, have all the orientation materials available for them, have initiated the process to get the folks through the orientation enrollment process. So I think that is the driver of what you're seeing.
So in other words, these numbers don't reflect people who are becoming providers for the first time. They simply reflect perhaps large numbers of current providers who are asking for eligibility for the first time, who are applying under the new law. Is that correct?
It's a combination of both. It's a combination of new providers coming in for the first time, but also existing providers that have been known to the system or been providing services who are also going through the new enrollment process, which, as the Deputy Director mentioned, includes the orientation, the background check, all of that. So it's a combination of both.
All right, thank you.
Mr. Gilmore?
Thank you, Madam Chair. For the background checks and the fingerprinting, who are you relying on to do this?
Sir, it's the Department of Justice. Those fingerprints are run through the DOJ Criminal Background Check Division, just like, for example, we would with an adoptive parent or a foster parent.
Yes. Who are there any licensed private investigative agencies providing that service, or are you allowed to access that?
Basically, there are counties that either, they deal with the Department of Justice, they have agreements with LifeScans throughout their counties, so that is an option that the counties have, and whoever is going to proceed with the process.
Very good. Thank you, Madam Chair.
Mr. Swanson, followed by Mr. Chesbrough.
Thank you, Madam Chair. First of all, just let me say, so it's clear where I'm coming from. I don't accept the notion that IHSS recipients should be treated like criminals. I think that is...
Please, I need the audience to remain silent. I appreciate your enthusiasm, but we need to allow Mr. Swanson to speak.
I don't... I'm having a hard time understanding that public policy. Let me ask you, on this chart, under your total E, it says 9,556, and these are providers completing the enrollment criteria.
Who have completed the enrollment criteria? Yes.
And then it has 9 the providers determined ineligible.
Correct.
And could you give me an idea of what that disqualification was, or?
That total of 9 is tied to, because of the temporary restraining order, we only have the ability to look at the 3 enumerated crimes, which is fraud to the government, elder abuse, and child abuse.
So those were individuals that were eliminated not based on any fraud. Is that what you're saying?
They were eliminated because those 9 individuals had committed either government fraud, elder abuse, or child abuse.
Yeah, but not necessarily in this program. Is that right? Is that right?
Correct.
Okay. And of those 9, how many had been previous providers?
I don't have that breakdown. I have the breakdown on existing and new providers for both the enrolled numbers and the pending numbers.
So do you anticipate that these percentages would continue? 1%, you'd find 1% that were ineligible to become providers. Just based on this sampling.
It's hard to really determine how many will be ineligible. Again, I think the complexity of the issue is the law had stated that it was all felonies and serious misdemeanors.
Yeah.
Due to the temporary restraining order. We went back to the 3 enumerated, so the numbers could significantly change depending on what happens. So
a substantial number of these individuals are disqualified because now there's a statute that says that they have had a felony, they can't provide these services, right?
The current process, due to the TRO, which is the temporary restraining order, means that if an individual commits any of the 3 enumerated that I mentioned, they would not be eligible to be IHSS providers.
The objective of this public policy is to what?
I think we're somewhat limited in expanding a lot of discussion given the litigation on this issue. In general, I think the goal of the budget agreement as passed by the legislature and signed by the governor was to ensure that providers who were providing services through the IHSS program are providing services and are safe to be in the home of an IHSS consumer.
Sure. Now, there's a lot of energy that your department is spending with all these new rules and approach. Have you figured out what the man and woman man hours involved in all this? What kind of additional financial burden has that placed on the department? Or is it like you guys can handle it, no problem?
No, I think I was pretty clear in my opening statement that these are significant changes, given the resource issues that I've acknowledged, the chair acknowledged in opening comments. It's a significant issue. The department endeavors to implement the law as it exists.
I hope that when we have our, as the chair indicated, when we have our additional oversight hearings, that the department is very candid with us about the costs involved here, for me and my colleagues to understand. I didn't vote for this policy, but I think it's important for my colleagues to understand what it costs. And if the objective is to go after fraud or to and abuse, and there has to be some kind of cost-benefit analysis to that makes sense. We can't just sort of get on this treadmill and go forward, and it doesn't make sense. So the last question deals with, you mentioned earlier about a federal certification of the recipient that takes place because they receive other benefits. Did you mention earlier about
Medi-Cal?
Yeah, right. And so there's a procedure that they go through to qualify for?
Well, first, as you know, in-home supportive services is a Medicaid service, and as such, we have to follow the Medicaid rules. Within the Medicaid rules, in order for someone to be a provider in the Medicaid world, they have to go through a suspended and ineligible list. They have to go through an enrollment process similar to what we're trying to implement here. So that's what was meant by that statement.
Yeah, good. Well, I just think this is inefficient, bad public policy. And I think that over time, if we see that that's the case, then we have a moral obligation to say that, and that in this budget climate, if we're wasting money chasing ghosts, then we should be just honest with each other about that, because someone's life lays in the balance because we don't have enough money to provide services, as we're sitting up here talking about cuts. And so if we made a mistake as a legislature, then someone ought to have the courage enough to say it. Thank you, ma'am.
Thank you, Mr. Swanson. And I do want to mention that a lot of the issues that you've raised, we will be drilling down deeply into in Budget Subcommittee 1. Mr. Chesborough, followed by Mr. Monning. And I do want to caution members, floor session has been called for 3. If we need to go a little later than 3, we will, but I'm going to be real careful of the time. And we still have another panel after this. So, Mr. Chesborough.
This is for Ms. Lopez or Director Wagner. I really appreciate this chart. It illustrates the progress that's being made towards enrolling folks, the eligible folks. But even, I guess what's missing is a projection out to 385,000 people by June 30th, and whether or not at the rate of gaining momentum here that you're showing, you're going to get there. You have any hope of getting there? You pretty much double it since the first of the year in less than a month. In both areas, both categories of providers who've completed enrollment and those who have begun the enrollment process. But nonetheless, I'm not a mathematician and I can't just visualize the rate of the curve. But have you projected out whether there's any chance that you're going to get to 385,000 by June 30th?
The honest answer there is program people prepared this graph, meaning my staff, and so we didn't do any type of projection. We're looking at the data points based on the system.
Okay,
but that's what we're looking at.
But we have people whose eligibility is hanging in the balance here. So that's sort of the $500 million question. It's not just maybe I shouldn't describe it as a mathematical exercise. It's the question for recipients about whether they're going to have their eligibility.
And as I mentioned earlier, based on the calls that we made to the counties, they have expressed a concern of being able to meet that June 30th date. However, these same counties are doing whatever they can to try to get the folks through the process, and we have we'll continue to provide them assistance in whatever way we can to try to meet that date.
I should have said crucial for the recipients to have eligible providers. Well, Madam Chair, I think it's going to be really critical, and I hope that you or the subcommittee chair, whoever the appropriate person is, or this committee will ask for a regular update to be reported on to the Assembly, because and this is the continued progress and the continued rate of growth of signing determining eligibility is absolutely crucial.
If I may, as I mentioned at the beginning of my speaking points, we will be posting this information on our website on a weekly basis. So that information will be there. And if there's a feeling that we need to, yes. Okay. As a matter of fact, what we've posted is we will actually post the county-by-county information which ties to the numbers. We don't post the graph, but if that's something that people are interested, we can do that.
Well, and we'll keep a close eye on that.
Well, and frankly, Madam Chair, if we had time to do it, I'd say we should be having it in public just like this. I think it's important that it be communicated to the committee, whoever you deem as chair, to be the appropriate.
Yeah, and I think reporting to the committee members, and then I post information on our budget committee website, and I do blogs and a whole lot of other ways of getting this information out as well. I do also want to note on this graph, I'm not a statistician, but it's clear that the gap between the blue line and I guess it's a pink line. It's hard for me to tell right now, but the providers that are in the that have not yet qualified, that are in pending status, the gap between those and the providers that have completed and are determined eligible is growing exponentially every week. And so that trend, if that trend is to continue, that means we'll have more and more providers that are in pending status, and that is very concerning to me. Mr. Monning, and that's our last member with questions before we go on to the next panel.
Thank you, Madam Chair. I want to thank members of the panel for your presentations. Clearly, you're motivated by protecting recipients' health and safety. In part, I am curious, following up on Member Swanson's question. Sounds like you don't have the data with you today, but I'd be curious to learn the cost projected to implement the further certification or investigation of eligibility of providers and recipients, and the projected number based on this apparent flat line of providers determined ineligible, the relatively small number compared to total number of providers and recipients. Can you, based on what you've gathered already, provide an estimate based on that trajectory and how much savings would be realized by the state with the disqualification of those ineligible providers? Is that something that can be projected?
Mr. Monning, Pete Chervenka, Department of Social Services. The cost of screening these fingerprints is borne by the provider. That was part of the budget agreement last year. So when somebody goes, say, to a LiveScan vendor, they pay $70. That covers the cost of processing that and returning results to the county. You're correct. There are some costs involved at the county level and then screening that and determining somebody's eligibility. Additionally, though, there are a number of other factors to consider, including the temporary restraining order that we're presently under. We're currently screening providers against a smaller list of crimes than it was enacted, obviously subject to interpretation by the courts last year. You will again see in our trailer bill package, as Director Wagner mentioned in his opening, that there will be a different list there. So there are a number of issues in play that will affect the number of providers that are screened out of the program. But in screening providers, you're exactly right. Our focus is on protecting the health and safety of the recipient. We have a shared interest in making sure that we don't put people potentially a threat to vulnerable recipients in a position where they could do that. So that's the purpose of the program, and yet another factor that should be considered.
Thank you. In the interest of time, thank you, Madam Chair. I would appreciate, and I think it would help our committee and the public, based on the data you've gathered already, some best estimates of how many you expect to disqualify and what counties can do in anticipation, even if it's a relatively small number, to pre-qualify replacements for those that, by your projections, are going to be disqualified. Thank you.
Thank you. Director Wagner, if you would provide my office with the link to your website. And I would really appreciate seeing the graph if you can continue doing that, because it gives you a visual snapshot that the numbers don't always provide. And so as soon as you give us that link, then we will distribute that to all the committee members.
Great.
Mr. Nielsen?
Just a quick additional request, maybe a report of the status of the lawsuits, what the expectation, the pendency of the appeals, and any of these things, possible resolution, and in the anticipation you're not successful, what would be the contingencies for coming up with another $200 million?
All I can say to comment on the lawsuits is that the litigation process has not been exhausted in any of the lawsuits that have impacted decisions on IHSS. The administration is continuing to appeal those decisions, and our budget assumes that we will be successful. That's all I can say on that.
All right, thank you very much. I really appreciate your being here and your testimony and the continued atmosphere of cooperation. I definitely very much appreciate that.
Thank you, Madam Chair.
Our next panel is, we have a large panel actually, and I'm going to try to ask everybody to limit their comments to 3 minutes, and we'll keep the timer going, so when it goes off I'll let you know to wrap up. Deborah Doctor with the Disability Rights California, Mark Beckwith, IHSS Consumer Advocate with Northern California ADAPT, Jovan Ajee with United Domestic Workers of America, and I believe you brought somebody to give personal testimony with you. Gail Ennis, President, California United Home Care Workers, SEIU, AFSCME, Local 4034, Helen Lopez, Executive Director of the San Bernardino IHSS Public Authority. And again, try to limit your comments to 3 minutes. It goes by really fast, I understand that, but I do want to give members here the opportunity to ask specific questions. So we'll start with Deborah Doctor.
Madam Speaker?
Yes, Mr. Swanson.
I have to, I'm called to Rules Committee, and I must leave.
All right, we do have members that are both on this committee and on Rules Committee. Rules Committee members need to go, and we are, again, starting session again at 3 o'clock, so I'm going to have to move this forward as expeditiously as possible. Ms. Doctor?
Thank you, Madam Chair, and thank you, members who have been so attentive this afternoon to this important issue. I think I have 6 points, 3 minutes. I'll talk fast. I actually want to respond to something that Mr. Ruskin said about, I think, the money savings of providers who are disqualified. The consumers still are entitled to services. So even though, you know, that provider may not work, this consumer can still get services from someone else. So it's not that disqualifying a particular provider saves the state money. I knew you didn't. Yes.
I was just trying to understand what exactly was being verified.
Right.
Yeah.
We are too. I want to bring up some issues from the point of view of consumers from my organization and the IHSS Coalition. And I think what the chart says to me is that there are a lot of consumers who aren't getting services because they aren't getting providers. That's what the chart says to me. And the reason that there has been a increase every month is that people have not been able to enroll providers in many counties since November 1st. And so the department's chart shows that if you look at the box in the top left of the page, it says normally they enroll 11,000 providers a month. And so far, in total, we have 9,556. That means it's the difference between those two numbers of people who have not been able, of consumers who have not been able to enroll providers. And when you can't get a provider and it's functionally the same as if you've been judged ineligible for services, but these folks have been authorized for services. They can't get the services they need. In Los Angeles, they're not going to be fully operational till February 1st. And that's where I think 40% of the caseload is. So I find the picture a little less comforting, I think, than has been presented from the viewpoint of consumers. There are important pieces of information that consumers don't have, and Ms. Lopez referred to that. They have never been notified that retro payment was possible. In fact, they were told retro payment wasn't possible. On the unannounced home visits that are occurring without any stakeholder process, and from the point of the consumer, it doesn't matter, who it is exactly at the door or whether they were authorized by this statute or some prior statute. For the first time, they're having people show up at the door. They don't know why they're there, why they're being targeted. We've heard that some are armed. I don't know that for a fact. Consumers don't know what happens if they say, I'm in the middle of a bath. I'm in the middle, or the worker says, I'm in the middle of doing this person's bowel program. Is it okay to say, could you come back later? Or is that going to be a ding against them? If they're not home, what's going to happen? We don't give anybody 24 hours services. People are entitled to be outside of their house. People don't know what any of this means, and they're scared. That's what we're hearing. The Polaroid policy. After we got over the shock of finding out that Polaroid was still in business, and learned that we're not talking about the instant thing with the carbons and all that, as the chair lady said, this is not in statute, and it is a big deal. And so if this is going to be subject to a stakeholder process, maybe it would have been good to have the stakeholder process before recommending this as a policy. I mean, we think that it's really outrageous that at a time when we're having a hearing about cutting off 90-something% of the recipients, we're going to buy a bunch of cameras with a technology we don't even know is going to be sufficient or why we're doing it.
I know it's gone by very quickly, but we've exceeded 3 minutes, so I need to wrap up.
I'm going to say one more thing. I'll skip my last item. And it's to follow up on what Mr. Swanson said. I hope that you all, with the benefit of these hearings, will reconsider what you voted for or what you didn't vote for, and whether it reflects what you want for this program, and take the lead if it doesn't. Thank you.
Thank you very much. Mr. Beckwith.
My chair's broke, so I can't lean it forward, but I know that the consumers that I know, I'm from Berkeley, and I've been receiving IHSS for 30 years, so I've had a lot of experience. And what people are telling me is people are really freaked out because they don't really know what's going on. It hasn't been made clear. There have been sort of different bulletins and announcements sent out without really good explanation. Sometimes they're conflicting. People are under the impression that if they hire a new provider, they won't be able to get paid retroactively from the time they started working, which I understand is the policy, but that has never been expressed to consumers. People are freaking out about home visits. I have a friend that's a single mother, and she's in a wheelchair, and she doesn't answer her door. If you don't call her and say, I'm coming over, you can knock, and she's not going to open it. And plus, I think there's a big feeling that this is all unnecessary. They thought, oh, there's people getting extra hours, so they did the Quality of Assurance Initiative. And they spent tens of millions of dollars and found out, gee, it's really not, people aren't getting a lot of extra hours. Now it's fraud. And the experts have been telling us for the last 10 or 15 years, I've been reading newspaper stories that the baby boomers are aging, and there's going to be an explosion in the need for care. There are articles in Wall Street Journal and other magazines, trade magazines for nursing homes, telling everyone, invest in nursing homes. It's going to be a real growth industry because we have all these disabled people. And then when it finally starts happening, everyone acts all sponsored. Why is there such a caseload growth? What on earth could be happening? It must be fraud. No, what they said was happening is happening. And we should be thankful that a cost-effective program like IHSS is here to replace nursing homes that cost 5 times more. There may be people that can struggle along without an attendant, but I think the estimate of the LAO of how many people end up in nursing homes and what it will cost, I think is just totally, I'd really like to have it explained to me how they came up with those figures, what kind of a crystal ball they have. They can say who's going to go to a nursing home and who isn't. $52 is a lot of money when you're making $11.50 an hour and working part-time in the Bay Area. And now you have to come up with $52 just to find out whether or not you'll be able to get paid for the work you do. It's really a big deterrent. It's a lot harder, it makes it a lot harder to find attendants. Right now there's a high unemployment rate, so it may be a little bit easier, but if the state of Virginia gets back on its feet, this $52 is going to be a big turnaway. And people with disabilities have no extra money. A lot of them aren't online. People keep saying, oh, it'll be on our website. Well, a lot of disabled people don't have computers. They can't afford them. They don't really know that much about them, and elderly people. And so you can't say, oh, it's on the website. People don't know what's happening. And the communication has not been good, and the whole situation has not been good. And I think that my ability to judge who to hire and not hire is just not even considered. It's like, oh, I'm vulnerable. Let's take advantage of the poor little dumb crippled guy. And I just resent it because I was attacked earlier, well, it was about February, about a year ago. And a caregiver for my brother came into my room to rob me before my attendant got there. And I woke up and had the covers pulled over my head, and you could hear somebody in the filing cabinet where I keep all my valuables locked up. Unfortunately, I have a buzzer installed so that if I need an attendant, I can blow the buzzer, which I did, and my attendant had come in and saw my door closed and heard me buzzing. He had to go down and stop the robber. And fortunately, he got the stuff away from the robber, and because of my attendant, but my attendant, with the aid of my trusty 3-cell flashlight, persuaded him to leave. And so now, the irony of this all is the attendant that robbed me had no criminal record, and the attendant that saved the day may lose his job because he had a conviction once for, aggravated assault or something. So the irony of this whole thing really hits me hard because he's one of my best caregivers.
Thank you very much for your testimony, Mr. Beckwith, and thank you for coming again. I know you've testified before this committee before, and it's always good to hear from you. Mr. Agee.
Thank you, Madam Chair. Jovan Agee, representing United Domestic Workers. I'd like to thank both committees for their continued attention to this issue. I would like to concede my time to a provider who's traveled here from San Diego. I think in the course of this dialogue, it's very important to highlight the realities of what exists. That is something that we did not have at our disposal in November. And what tends to happen in this building is we have a lot of debate over hypothetical situations. So what I would like to hopefully, through her testimony, provide a dose of reality. Her name is Nancy Riley. She's a provider from San Diego. And like I said, I'll allow her to use the rest of my time.
Thank you, Ms. Riley.
Chairperson Evans, members of the committee, I'm grateful for this opportunity to testify before you. My name is Nancy Jo Riley, and I'm a live-in care provider. I make $9.50 an hour, and yet I am being required to pay out-of-pocket unnecessary background checks and fingerprinting, creating a hardship on me, even though I have provided excellent care for 23 years for one of the most severely impaired individuals on the program. His name is Michael Condon. He's a C3 quad, totally paralyzed, who served honorably in the U.S. Army military police during Vietnam. He now must ask to have an eyelash removed from his eye, and he requires around-the-clock care. Michael and I continue to serve our community and volunteer at local schools, the VA hospital, San Diego County Advisory and Public Authority boards. So we were shocked and frightened when we received notices from 2 separate state police officers and a phone message from a fraud officer, Alberto Hollings, threatening that Michael's benefits would be terminated if we did not meet with him immediately. Officer Hollings displayed his badge and demanded our photos and IDs and Social Security numbers. He didn't need fingerprinting and a Polaroid. He said that we hadn't done anything wrong and that we were randomly selected for the fraud interrogation. After a long and humiliating series of questions under penalty of perjury, questions such as what was Michael's disability, was he happy, was the care adequate, have I ever been convicted of a felony or a misdemeanor, which I asked, does a traffic ticket count? Officer Hollings then confessed that he was confused about Michael's case not being kicked back due to the severity of his disability. He apologized for threatening us earlier. I asked how Michael will be fingerprinted since his hands have contracture, which means you cannot open up the fingers to fingerprint, and he assured us that there would be some kind of case-by-case basis and that would exempt us, since they are realizing they need a case-by-case exemptions because quite a few of the convicted felons turned out to be spouses, parents, or children, and no one wants to separate family members. I inquired what he was doing before he was pulled for this new mandate, and he said nursing home fraud, saying his services were really necessary there. Michael added that not only does institutional care really terrify him, it would cost the taxpayer 4 to 5 times. Since these home visits are not based on probable cause, and I am not a Medi-Cal recipient, does this not violate my Fourth Amendment right? A few days ago, I was contacted by a consumer named Dolores Thompson, and she is an iron lung, and she told me that she's not sure, because she was communicating over a telecom, whether or not it was a county worker or a state fraud investigator, but the person on the intercom, it was a woman, was yelling that she was at the maximum 283 hours and that she was under a fraud investigation, but Dolores couldn't move since she was in an iron lung and couldn't answer the phone, and the woman went away. Members of the committee, you have allowed the state to slander hundreds of thousands of dedicated home care workers and those that we provide for as fraud criminals. I urge you to stop these unfair, unnecessary, unannounced visits and fingerprinting and background checks that will only result in a costly juggernaut of a bureaucracy. History will judge us as a civilization as to how we protect and care for our most vulnerable citizens. I hope you help us.
The hour of 3 o'clock having arrived, the Assembly is back in session. If members will please immediately return to